You don't need an MRI to know if you have pelvic instability or not. You also don't need any fancy equipment to do that. In this video, I'm going to show you 3 different exercises that I use to assess a patient for pelvic instability and see if the cause of their issue is coming from pelvic instability. So the first thing that I want you to understand is why stability matters more than flexibility for pelvic health. And also, I'm going to show you how to spot the difference between the strength and compensation. So the first test that I want to do is biological breathing. Biological breathing is the type of breathing we understand by studying human babies. All babies, in fact, you and I, when we were babies, we were breathing a specific way. We did that throughout the first few years of our lives until we started creating unhealthy environment. Unhealthy environment meant we went to school and we sat for 7-8 hours. And that, in today's society, more industrialized nations, that's even a lot more because kids don't go out to play anymore. They're too busy playing video games. Bottom line here is it changes our breathing patterns. Then you look around and there's so many different types of breathings. It's like which is which. We talk about abdominal breathing or belly breathing, which is not something I like because I've seen it done so many times the wrong way. So I refer to biological breathing as the breathing we biologically, without anyone telling us how to breathe, we breathe. When we study biological breathing, we see that as we breathe that way, when we breathe in, the muscles inside your pelvis, right in here, get relaxed. And in the process of breathing out, the same muscles very gently and softly and kindly and in sync with each other, they contract, so you breathe out. So every breath, when done biologically, will relax and strengthen those muscles. So I want to know, how does this individual breathe? Because if they're not breathing correctly, I know they have pelvic floor dysfunction and they have stability issue. Because if the muscles inside the pelvis with the surrounding area work together in harmony, the pelvis will be stabilized. When they don't, the muscles on the inside typically have to overcompensate for what's not happening on the outside, and that comes with certain clinical presentations. So, can this individual breathe biologically? How do I go about doing that? Just like this. So I ask the patient to lay down on the floor. Can you see me? I'm gonna have to move farther away. Can you see me now? Great. So you're gonna be laying down on the floor with your knees bent. Your knees are wider than your pelvis and your feet are a little bit closer to each other. So that's how a baby, basically I'm duplicating what babies do. Are you able to close this gap in the small of your back? So go ahead and do this with me. Are you able to close this gap by gently rotating your pelvis up? That gentle rotation requires the front of your pelvis, where your abdominal muscles are connected, to pull up, as the muscles in the back part of your spine will give the consent to get longer. So the rotation is a gentle rotation. If the individual clenches their butt and shoves it up, if they clench the perineum to just move the pelvis up, or if they use their legs connected to the pelvis to shove the pelvis up, those are all compensations and not done right. So I know this individual is not using their pelvis correctly, and that only happens when compensation and modifications have taken place. So this is a sign of pelvic instability. If it's not there, then I'm not going to proceed with what else has to be there for the biological breathing to be done correctly. Sometimes the individual uses the top portion of their body. So again, I'm gonna lay down, and it's they do this, kind of pushing the top down to try to pull up. That's another compensation, because once again, any deviation from what needs to be in place is a modification this body has learned as a result, or an adaptation to what's not there. So pelvic instability is the case in this case. The other exercise that I do, or I ask the individual to do, is a version of a functional bridge, which is an advanced exercise that I do with my patients once we go through the treatment process. A lot of these tests that I do with my patients become the exercises that we do later on once the treatment begins. If you have not subscribed to my channel, this is a great opportunity for you to do that. I use my YouTube channel to basically share everything that I find to be valuable in my practice. I provide tips and basically alerts, things like that, on this channel and on my social media. Make sure you go to my description box for this video to see where else I exist. Make sure you sign up for it, or you subscribe to this channel, and you also follow me in other places, because my whole goal is for you to understand what right is, what your version is, and replace your version with the right. Of course, if you need help, I'm here, so you need to contact my office to ask for help if that's the case. But make sure you do that. Now back to the exercise. The next exercise is what's I refer to as functional bridge, only this time I want to have one leg up. So let me explain. Once again, you're laying down on the floor, the small of the back is closed, your pelvis is in a neutral position. Your heel's about middle finger to index finger away from you. So you can see that my heel's not far away from my finger, it's touching my finger. I am as wide as my pelvis. My knees are as wide as my pelvis. I spread my hands, my neck is elongated, my spine is neutral, so I'm not tilted down. And I go to gently, slowly lift my pelvis off the floor. And now my knees are going towards the wall in front of me. So the thighs like a cannon, and the cannonball is exiting my kneecaps out towards the wall in front of me. So I'm stretching as my back's going up. It's not my glute clenching or my butt pushing me up. It's everything working together, and my legs are being stretched that way. So that's the connection of my leg to my pelvis, the connection of my spine to my pelvis, and of course the different parts of my pelvis all together are contributing to this move. Now I want to see, is this individual able to maintain this position with one leg up in the air? So in order for me to do that, I want to balance myself between the left foot and the right quadrant. And I'm placing my hands here. My hands are not supporting or pushing me up. They're just keeping me in place. And I want to lift my leg up in that direction. I'm looking to see, does this individual drop the pelvis or side bend or do anything like that? If they don't, that means pelvic stability is in place. So I have looked at the different connections to the pelvis. I have looked at biological breathing, which provides better environment for the muscles inside the pelvis to work well. And finally, I'm going to go with a standing up position. I just got distracted by someone calling, of course. So we're gonna go ahead and stand up here. And in this position, I'm going to stand up and I'm going to be Essentially, my feet are as wide apart as my pelvis. I want to stand on one leg, but I'm not going to just go, I don't want to see this happening. What I want to see is, am I able to just shift? Do you see that? Shift. I'm not doing this. My butt's not going that way. Can I shift, hold, bring the leg up, and hold this position? Really, the ankle stability is not what I'm looking for. What I'm looking for is any tilting or rotation of the pelvis. When I'm able to do it, pelvic stability is there. Any deviation from that means this is a compensation, this is instability in place, and it is hard to expect the muscles inside the pelvis to behave in any healthy way when the environment is not healthy. So the interpretation of the result is very, very important. We have to pay attention to the details. We're looking at, essentially, unfortunately, when it comes to healthcare, at least in the world of clinical rehab, physical rehab, I can tell you that essentially the providers are looking for a slap in the face and anything that fits what the textbook says, whereas we need to investigate a lot more. So if you have complicated or chronic condition that just is not, you're not getting the result you're looking for, the provider is missing certain signs, you are missing certain signs and symptoms, you're not connecting the dots the right way. Sorry about the interruption here, but hopefully you were focusing on what I was saying. And anyway, thanks for watching. Make sure you comment, or if you have any suggestions for any other videos, make sure that you put it in the comment section here. And until next time, take care.